desert island or something.
All right, you ready for another one, Tace?
Yep.
Here we go.
58 seconds left.
Cool.
Hey, Dr. Steve. This is Jeff from Las Vegas.
Hey, Jeff.
I was calling
Hey,
because
Jeff. I'm going to be in Las Vegas May 31st to June 2nd, observing Hackamania.
I figured you're going down to see Dead and Company.
Oh, are they going to be there?
Dead and Co. are there too. Yeah, you went to see In the Spear.
Really?
Yeah, you went to check that out for real.
Well, I will do that.
Oh my God, that'd be fun.
Yeah.
So what are you going? Hackamania?
Yeah, Hackamania with El Harible and the WATP crew. So El Harible and I are going to try to do a poker tournament while we're there.
Okay.
And if we have time, I don't have a whole lot of time. I mean, the part of the main event is on Saturday night, but I got to catch a plane at 12:40 a.m. Sunday morning to get home at a decent time on Tuesday. I mean, on Sunday. So.
Oh, the red eye home.
Yeah.
Oh, that's gonna.
I like doing that. I just sleep. I sleep anyway.
So rough.
I have no trouble sleeping on a plane.
I can't.
None.
Not even close.
Really?
Nope.
As soon as, oh God, dude, when I get,
Not close.
this doesn't count for the 3 minutes.
Well, that's not for you to say.
Okay, let me answer this. Then.
I'm curious about something a doctor told me about.
Oh yeah, he hadn't even asked his question yet,
Oh,
so the timer hasn't started
We're
yet.
already answering it.
Anyway, as soon as the plane, the engines start up, I fall asleep, and I have multiple times woken up thinking, "God, are we there yet? We haven't even taken off." Yet.
Oh my gosh.
So anyway, all
How
right,
funny.
very good.
In regards to white blood cell count,
Okay,
I'm 34, I underwent chemotherapy about 10 years ago for testicular cancer, and it absolutely crushed my white blood cell count. And I mentioned it when reviewing the blood panel I just did. My white blood cell count was pretty low. I can't remember what the metric was, but it was 3.15 something. And she had mentioned that there's basically the white blood cell equivalent of EPO, and I might want to look into that the next time I see my oncologist.
correct.
So, I don't know, I was just going to see what you thought about that. Love the show.
Hey, thanks. So back in the day when we gave certain types of chemotherapy, 50% of people would end up in the hospital with a thing called neutropenic fever. And what that means is their white blood cell count would drop so low that the body said, the only defense we have right now is to raise the
Spike the
temperature.
temperature. Huh.
And people would end up in the hospital in isolation until their white blood cell count came back up, and we'd have to pump them up with antibiotics just prophylactically to make sure that they didn't get, some bacterial infection. Now we have this stuff called, there's Neulasta and Neupogen, those are the brand names, and they are white blood cell colony factor stimulators. So when you give those right after you give the chemotherapy, it boosts the patient's white blood cell count. And now, instead of 50%, we're down to like 1%. That's huge.
That's unbelievable.
To go from half your patients down to 1 in 100 ending up in the hospital with neutropenic fever. Now, the problem with the white blood cell count colony factor is when it forces all these immature white blood cells into the bloodstream, it causes bone pain. And so sometimes we have to give those patients pain medication. Okay. But the cool thing is, if you take loratadine, here it is again. Isn't that interesting? Loratadine being a non-drowsy antihistamine, also sold as Claritin. If you take it on the day of your chemo and keep taking it daily for the 3 days afterward, then when that white blood cell count colony factor is kicking in, a lot of patients won't have any pain at all.
Wow.
And do you remember what the other thing loratadine is good for?
No.
Oh, that's fine. Tacey, do you
Allergies,
remember?
but-
Allergies?
Besides allergies, yes, of course.
No, I don't.
Was erectile dysfunction caused by SSRIs or any sort of sexual dysfunction like delayed ejaculation, stuff like that, caused by antidepressants.
Wow,
And it doesn't work in everybody, but there's a significant subfraction of people that if they'll take those drugs 30 minutes before intercourse, then they won't have as much effect from their depression medication.
Wow.
That's something.
Yeah, it is. It's incredible, really.
All right.
Oh,
So there you go. So
Good
yes,
stuff.
your oncologist should already be using these drugs, And if you had one episode of low white blood cell count, they'll start using them from then on.
Right on.
You used to have to come back the next day for a shot. Now they got a patch that they can put on you.
Right.
Okay?
Yeah, it's sir, come a long way, hasn't it?
Yep.
Golly.
All right.
9 seconds left.
It's close.
Hey, Dr. Steve, it's Dr. W here, another dentist calling.
Hey, Dr. W.
I just thought I'd let you know that Dr. H there guy, he's kind of talking out of his ass. There's been no change in the prevalence of wisdom teeth or any other teeth or missing thereof in any of the literature anyway. There's no evolutionary pressure on the species.
Of course. I think this is from several months ago, but I can't. Well, let him finish and then we'll talk.
Not have these wisdom teeth. But yeah, otherwise everything else seems correct. Anyway, love the show. Have a good one.
Hey, thanks, buddy. So, the way that humans or any other species evolves is that there's some environmental pressure.
Okay.
So, if you are some, mammal, and in your area, all of the ground, the food on the ground is being eaten up by deer and antelope and stuff, you may start to select your DNA for offspring that have longer necks.
Okay.
That can reach higher where the deer and the gazelles and stuff can't reach because they're eating grass or whatever. And then, after a few million years, you end up with a giraffe.
Okay.
And but there was an environmental pressure for that giraffe, proto giraffes that had longer necks, their DNA was more preferentially passed to the next generation. There's no, unless women started going, ew, you have too many wisdom teeth, I'm not going to have children with you, then there's no evolutionary pressure for us to lose wisdom teeth. It's crazy. Just like if you take rats and you keep chopping their tails off, they're still going to be born with tails. That's not an evolutionary pressure. You're just doing something to them. Now, there is a thing called epigenetics that may have some effect. That's where not just the DNA, but these proteins that decide which DNA fragments to turn on and turn off, that could be affected by things like chopping a tail off, but so far that really hasn't shown to do anything. So you would have to preferentially mate rats with smaller tails, shorter tails, to get a subspecies or a strain of rat that had short tails.
Okay.
All right? There you go. So thank you. Was it Dr. W? Is that what he said his name
Dr.
was?
W was, yes. Thank you, sir.
Hey, Dr. Steve, it's Dr. W here.
Yeah, Dr. W.
Cool.
Thank you, sir. We always like having dentists on call because that's one thing they don't teach us anything about in medical school. Nothing about dental health.
We need a dentist in here sometime to talk about the importance of
We had one. Well, okay, different show. We had an oral surgeon in here talking about implants. That's why I have an implant.
Okay,
I have
gotcha.
2 implants.
Gotcha.
Except he kind of lied. He said, well, you don't have to implant every individual tooth. You can just put in 2 or 3 posts and then you put the teeth on there. And then when I go in there and it's like, oh no, we're going to charge you for all the individual teeth that we're going to put in.
Lovely.
I had too much fluoride when I was a
much?
kid. Yeah, you can have too much.
Oh, wow. Okay.
And what it did, it made my back teeth brittle, so they were breaking.
Oh, gotcha.
And they was just, I would break
Bell.
the farthest one, then the newest one,
Uh-oh.
and then the next one.
Damn
So-
it.
Anyway, so now I have implants. All right, here we go.
Hey, Dr. Steve. This is Mike in Florida.
Hey,
Fuck
Mike.
PA John. Long-time listener. Love the show.
Wow, that
He must be a long time listener.
That goes way back. Fuck P.A. John. God, he used to hate that, too. He was like, why did they say that? And it's like, John, it's a goof. It's like when they would call Howard Stern and say, fuck, F. Jackie. It was just funny.
Florida. Fuck PA John. Long-time listener. Love the show.
Thanks,
Got a
buddy.
question for you.
Yes.
I have a pain on both my legs, at the top of the leg where my leg meets my butt cheek. And
Okay.
it'll just come and it'll hurt like the son of a bitch, and it'll make my legs feel very weak. So did I do something to my hamstrings, or just what's going on there, sir?
What do you think, Dr. Scott?
Well,
I
that's
think
where
we
his
answered
hamstring,
a very similar
because
question.
that's where his
last week.
hamstring attachments are. But it sounds like a little sciatica, kind of piriformis. If it's right where at the bottom of his glutes, where his hamstrings attach, sounds a little. If he's getting some weakness maybe some sciatica.
Okay, so if it's piriformis, tell him what he could do about it and what the piriformis is.
Real quick, piriformis muscle is a big fat muscle deep underneath your big gluteal muscles, and in a percentage of people, the sciatic nerve actually goes through the middle of the muscle.
Mm-hmm.
Some people actually goes underneath it. Most of it loops over, so it's not as much of an issue. But sometimes you can have a muscle piriformis spasm that'll give you the exact same signs and symptoms of a sciatica coming from the spine, like a discogenic sciatica, we'd call it. So what you can do if it's a piriformis, here's a good way to check it out. If you can just sit and cross one ankle across your other knee while you're sitting up and lean forward, and if that kind of stretches it or elicits some sort of pain, then that's probably what it is.
Now, isn't that one of the stretches that they tell you to do as you get on the ground?
Yeah. We call it in yoga, it's called the pigeon pose, and it's really gentle. But the key to it, Dr. Steve, the key to it is 20% of max stretch for 2 minutes. In other words, just
tell them how to do it again.
Gently. It's a pigeon pose. So what you actually do, if you're sitting in a chair, both legs kind of 90 degrees, just take one ankle and cross it over the opposing knee. So if it's my right leg that hurts, I'm going to take my right ankle.
Right, so you're gonna cross your legs like a man,
like a real man. That's right. And then I'm gonna sit up real nice and tall and slightly lean forward. And if you can start to feel that kind of pain recreated going down your back of your legs, there's a good chance it's a piriformis. And it's but the key is, again, 20% stretch, very gentle. Don't hurt yourself.
Okay. That's always the thing is, don't hurt yourself. You got anything else to add to that?
No, I'm sorry. I was just going to say you can look on YouTube and check out pigeon pose, yoga pigeon pose.
Or just piriformis stretch.
Just piriformis stretch, yep. The key is gentle, though.
There's one I see that they're doing where they do it with the person laying on their back.
Yep.
And they're taking that, but it's the same thing.
It's the same thing.
You take the ankle, put it over the opposite knee, and then pull the knee up.
Yep. Damn,
okay.
Timer, yes.
I know. Tacy's, God, she's
a timer taskmaster.
I love it.
Well, particularly when we're actually trying to help somebody, and then Tacy's like, "Oh no,
timer,
just stop talking." Okay, here we go.
Hi, Dr. Steve. It's Audie from Pennsylvania. I have this pressure beneath my eyes and the bridge of my nose, and it's been bothering me for about a year. My eye doctor doesn't find any problems with my eyes or my vision. He said I should just use some dry eye drops. I've been doing that. It really hasn't helped. I'm wondering what this could be. Could it be from squinting? Could it be from vaping, THC? I'm really not sure. I was wondering if you've had any experience with this.
Let me hear
Thanks,
the very
Dr.
beginning of that.
That's what I'm saying. One more time.
Pennsylvania. I have this pressure beneath my eyes and the bridge of my nose.
Okay.
And it's been bothering me.
Okay, so it's pressure, not dry eyes. So, and he says he went to his eye doctor. I wonder, assuming it was an optometrist. I would go on this one, and no flies on the optometrists out there. I had my optometrist, one that figured out something crucial on my eyes. So I'm a fan of optometrists. But when they can't figure it out and you have pressure behind your eyes and they're giving you eye drops and it doesn't help, go to an ophthalmologist. They're going to have to look at a couple of things. They're going to test the actual pressure in your eye, make sure you don't have glaucoma.
Yes.
They're also going to test your eye to see if it is protruding, because perhaps you may have a thyroid condition that's causing protrusion of the eyeball. And at the very least, they'll have something better to tell you than just take eye drops. Now, go ahead.
Well, I was just saying, what about maybe just some sinus allergy medicine just in case it's a sinus pressure?
Yeah.
Well, possibly. Yeah, I mean, until he gets to the...
Sure, I have no problem with that.
Ophthalmologist.
However, if he has glaucoma, he may not want to take an anticholinergic medication.
Right.
But the vaping of THC there are anticholinergic effects. We all who've listened to this show long enough know those are fast heart rate, dry mouth, changes in the pupils, stuff like that. And yeah, that could be it. So, but how would you know? Just stop
Just
it
don't
for
do it for a day or two. Yeah.
Well, I was going to say 2 weeks. Give it 2 weeks, and get a neti pot or a Navage, and try Dr. Scott and Tacey's idea that it's just actually sinus pressure.
A little sinus rinse will work too,
and then go from there.
Before I had my deviated septum surgery,
Yeah.
I had pressure behind my eyes.
Is
and,
that right?
behind my sinuses, and you could see it in my face.
And that went away after you had your. But you had a concha bullosa too, so which was even crazier.
So I mean, if what you say doesn't work, ear, nose, and throat maybe.
I agree. Now the thing is, you don't want to lose your vision. You can deal with the deviated septum for a little bit. So if it is something like glaucoma or Graves' disease or something like that, you want to get that dealt with quickly. So deal with the scarier thing first, which would be going to the ophthalmologist. If they go, hey, you're fine, then I agree with Tacey, and she and Dr. Scott should get a bell.
Give thyself a bell.
For recommending going to see an ear, nose, and throat doctor.
Damn it.
Okie doke. All right. Very good. Well, appreciate everybody. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Goodbye, everyone.
See ya.